Well, Dr. Doyin Odubanjo joins us now as we continue our focus on the EVD threat. He is the first Vice Chairman, Association of Public Health Physicians of Nigeria, that's the Lagos chapter. He's also the Executive Secretary, Nigerian Academy of Science. Thank you for coming on this morning.
Pleasure, good morning.
Well, interesting focus on this now, but the one that raises perhaps more concerns happens to be that one of Port Harcourt. But give us your assessment of how we're going about this so far.
Well, I think what we have so far is rather good, and as some have described it, unprecedented, really, because the response was relatively fast. The effect is seen compared to other countries like Liberia, Sierra Leone. We can see the casualties. We can see how things have spiraled kind of out of control. But in Nigeria, first and foremost, when we hear, for instance, about contact tracing, that's not an easy thing, but for people to actually sit down, try to mark out who has come in contact with every single case is very detailed, very meticulous, difficult to do. And then have to follow them up in some form or the other is also very difficult, time consuming, human resource challenging, and indeed the kind of things that have been used, even the use of GPS, mobile phones and all of that in tracking and following up people. It's amazing really what we've done this time around.
The one in Port Harcourt, that WHO comment saying it just could spread faster because of the way it broke. I mean, in Lagos, the index case, everyone could identify that one. But for this one in Port Harcourt, we understand for weeks, he was in town, he didn't let anybody know, he contacted several people. Now you have a wider net of those who are placed under surveillance. How optimistic are you that we can approach this nicely?
I think just like with curtailing Ebola outbreak anywhere, we can actually curtail this. It only take the collaboration of everybody, not just the people on the field, not just the workers in the Ebola Operations Center, but to take everyone's cooperation. For instance, it's going to take, for instance, people who knew they were in contact with that man to come forward by themselves. I wouldn't expect that I'll have to wait for somebody to try to track me down. If I was in contact with him, I would want to report myself and say, hey, I was there, I saw him, particularly when he was sick. I was at his house, I went to visit him, he was sick, I heard about it, he's my friend, and I went there, and are you okay? Yes, I am, but I just wanted you to know, and then they'll tell me what I need to do. They'll tell me who to call in case I fall sick. So if we all do our part, kind of, this is not something that's, it's not like some video people have already made. They said Ebola is the end of the world. It's not the end of the world. The only thing is that we all have to act responsibly. Every one of us has to cooperate on this. The media has to play its part. Everybody else has to play their part. Sometimes you have to be your brother's keeper, also by reporting him maybe if he refuses to do so.
It sounds so simple the way you have just put it, but one wonders why some would still want to go underground, just as the diplomat has done by bolting away, and at the end of the day we have another problem in our hands. We saw a video not here in Nigeria, in Liberia, where someone actually left the camp and said he was out searching for food. It brings to question what some have actually said about the camp or the quarantine area where these people are being kept. How well have we been able to give them their basic amenities so that they don't have to live where they have been kept for under close watch?
Right. Well, first, Nigeria is not Liberia. Not to talk down, really, but to say that Liberia had been ravaged by war. Liberia had very little resources, and given the complexity of Ebola, as it were, it was easy for everything to entirely break down. And that's what has happened in Liberia.
That's a video.
Okay, now look at this. I think we should just give it some volume so you could just listen to this part.
It's actually a report.
Now let's hear the video. Let's listen to it.
After a tense standoff, the man is surrounded by medical personnel and a doctor and is eventually bundled into an ambulance. Liberia has the highest Ebola infection rates in this latest outbreak, with around 700 deaths out of more than 1,300 suspected and confirmed cases.
So as I was saying, yeah, you have actually explained the complexity of the issues and well, the similarities and the likelihood. But when people see a video like this, that someone was out looking for food, and if you're a Nigerian, for instance, you have had contact with one of these people, there's bound to be this fear that perhaps this is what it is like in the camp, that by the time I present myself, I may actually be deprived of even my basic food. Amenities.
Absolutely not. And I'm happy we're talking about it because it's the fears that people have, that make them go underground. So I'm happy you are raising it, but it's absolutely not the same thing in Nigeria. And then I would also like to raise a caution to say don't use the word camp because it's not a camp, it's not a prison, it's not anything of the sort. It's a hospital. Okay. It's a ward. The only thing is that it's an isolation center simply because you don't want everybody walking in and out like you normally would do in a normal hospital. So not even the health officials themselves, the doctors or nurses, come in the way they normally do. They have to be all kitted up, all dressed up. So that's the only difference. But it's just a hospital ward. And as we have it now, even in Nigeria, the new ward in Lagos, for instance, visitors do come. So family members can come there, and they can stand at a distance, to see their relative who can stand by the window or whatever, wave at them, talk to them. So it's not a camp, they're not locked up. Food is provided. In fact, it's important to provide good food because you need the nutrition. You need them to, you need that for their immunity.
Tell us more on that, because yesterday the headline tried to give us an analysis of those that have actually survived, and we were really, really pleased with that particular report. Because before now, one would have thought that no one would have survived any of this. What do they really do when they care for those people?
Well, when the people come in, you see, the point is giving the symptoms. The virus itself is not like some guy who holds your neck and kills you. It comes in and causes certain symptoms which will lead to complications that will kill. So, for instance, if the man is vomiting, if he's stooling, he's losing a lot of liquids, so it's going to become dehydrated. It's the same thing that happens to a child with diarrhea. The real thing that will kill the child is that the child becomes too dehydrated and therefore would die. But that's not necessarily what caused the stooling. So what happens is that you are going to take care of all these complications, ensure that the fluids are being replaced. As fluids, so to speak, are being lost, the man is also losing what we call electrolytes, which are like small ions in the body, sodium, potassium. Those things could kill quickly if they become deranged. The levels are not right in the body. So again, you want to measure those things, replace them appropriately. You want to ensure good nutrition. Because even any one of us, when you have diarrhea, you lose a lot of nutrients, and then you start finding yourself losing weight and whatnot. So you want to ensure they're again well nourished. And when all of those things are well taken care of, what happens is that you're giving the body the chance or the time, if I may put it that way, to actually recover by building up its own immunity, which will now kill off the virus.